Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder if your therapy sessions could be way more effective if they were, like super tailored just for you? Well, this new study dives deep into exactly that. Imagine going to therapy for something complex, like chronic pain. Therapists do their best to help, but sometimes those standard treatment plans just don't quite fit everyone perfectly. That's because everyone's experience is unique. Right? What if instead of just going by general knowledge, therapists could use your own data to figure out the exact things to focus on to help you the most? This study is a test, a proof of concept, to see if a super personalized approach to psychotherapy using your own data is actually doable and if people like it. Think of it like this: instead of a one-size-fits-all jacket, imagine a tailor-made suit. That's the idea here. They tried a new way to make therapy super personal. How did they do it? Well, they used something called Ecological Momentary Assessment, or EMA. This basically means people got asked questions on their phones multiple times a day for a few weeks. It's like a super detailed diary of your thoughts, feelings, and experiences in real life. Then, they took all that information and created a person-specific network. Imagine a spider web where each little point is something like feeling sad, or avoiding exercise, or worrying about pain. The lines connecting them show how these things affect each other. This network helps spot the most critical points, the ones that seem to drive a lot of the other problems. These critical points become the treatment targets. Once they had those targets, they matched them with specific therapy techniques that are known to work for those exact issues. To see if it was actually helping, they used a method called single-case experimental designs. This means they carefully tracked each person individually, comparing how they were doing before the treatment to how they were doing during and after the treatment. So, they had 12 patients dealing with chronic pain and 9 therapists. They used a design that is like an ABAC, don't let the fancy name scare you. It basically means they observed a baseline period, then introduced a treatment, then had another baseline period, and then another intervention. This is a standard way to see if a change really makes a difference. They tracked if people stuck with the program and measured how much their disability lessened. After the therapy, they talked to both the patients and therapists to see if the whole process felt right and was easy to use. And what did they find? Well, it wasn't perfect, but it showed promise. People generally stuck with the program, with most participants completing at least 80% of the daily check-ins. The individual results were a mixed bag. Some people showed clear improvements, while others didn't see as much change in their target areas. However, when they looked at the whole group, there was an average decrease in disability scores. This suggests that, on average, the personalized approach helped people feel less disabled. The really interesting part from the interviews was how both patients and therapists felt. They highlighted how important it was to have the assessment design focused on the individual. Also, the self-monitoring part where people were checking in with themselves. And the structured way they talked about the data together in therapy, these really helped people understand what was going on in their daily lives and supported deeper reflection. So, what does this all mean? The study basically says that this whole idea of using your personal data to guide therapy is feasible, and that people accepted it. It's like a cycle. You observe what's happening in your life with that daily check-in. Then you decide what's important based on that data, and then you intervene with targeted therapy. The researchers think the real magic of this data-driven approach isn't just about smart algorithms, but how it helps doctors and patients think more deeply together, focusing on what truly matters for that specific person. This is a really big deal because, as the researchers point out, often treatment guidelines are for groups and can be a bit blind when it comes to individual needs. This study suggests a way forward. They use something called EMA, which is like a detailed moment-by-moment look at your life. Then they use network analysis, which is like mapping out how your symptoms and feelings connect. And finally, they used single-case experimental designs, which means looking at how treatment affects you as an individual. They all work together. Now, of course, no study is perfect. These researchers were upfront about their limitations. They mentioned that the study had a certain risk of bias, meaning it wasn't a perfectly controlled experiment. Getting people to start their assessments at the exact same time was tricky, and it is hard to keep people from knowing if they're getting the real treatment or a comparison. Also, they're not totally sure which part of their method, the EMA, the network stuff, or the evaluation was the most important for any changes they saw. It could be the combination. And with personalized data, it's harder to say that what works for these 12 people will work for everyone. Generalizing findings from individuals to a whole population is tough these days. But here is the exciting part: the so what. This study shows us that using technology to collect detailed personal data and then using that data to make therapy decisions for you can be a really valuable thing. It is not just about the tech itself. It's about how it helps doctors and patients communicate better, understand problems more deeply, and make more informed choices together. It's about making therapy more reflective and less intuitive, which can lead to better outcomes, especially for really complicated issues like chronic pain. They think we need to focus not just on fancy tech, but on making these systems understandable and practical for real therapists and patients. This research opens the door to a future where therapy is even more precise and effective because it's built around you. The continued development of these personalized approaches, especially considering patient experience and ease of use, is going to be fascinating to watch. What do you think about this data-informed therapy approach? Could it help you? Let me know in the comments below. If you found this breakdown helpful, please hit that like button. Subscribe to Rubin's Mind Lab for more science explained simply. And ring that notification bell so you don't miss our next dive into the world of psychology. Thanks for watching, and I'll see you in the next one.